my name is Rasha Altaie. I am ophthalmologist with a subspecialty in paediatric ophthalmology and anterior segment. So I am a co-founder of the Myopia Working Group, passionate about myopia in children, as well as other sub-branches that really attract me, including allergies in kids, a condition we call it keratoconus, which has changed the shape of the cornea because of severe allergies, and in addition to my passion in cataract surgery. So the main reason I think we decided to meet because of one of my passions, big passions, is myopia in children, which is one of the most common cause of visual impairment for people under the age of 40. The reason actually behind why like Australia, New Zealand Myopia Working Group created, because myopia is short-sighted, which means that the person can see well for close-up, but they cannot see far away. And it's considered as a benign condition because you can correct it with the glasses, contact lenses, and later on refractive surgery if the patient, if the person wants during adulthood. However, it has been noticed that the incidence and the prevalence of myopia is on the rise. So because of, it has been increasing, noticed in the early 2000s that its prevalence has been increased. And although myopia at its low grade, it's considered as a benign condition, when it becomes high myopia, it could be associated with conditions that may cause irreversible visual impairment. And because it is quite associated with environmental factor, so we felt as a health professional, it's our duty to start to educate the population about what is myopia, how can we prevent myopia, or at least, because there are some genetic elements in it as well. We cannot stop genetics, but at least we could modify the environmental factor to prevent the kids from becoming high myopic, which is like the degree becomes high, and which would subsequently may cause visual impairment. So the WHO has announced it as public health crisis because the estimate by 2050, half of the world populations are short-sighted and 1 billion has impaired vision. It may be irreversible. So that's where we thought we have to create something to raise the public awareness. Interestingly, Anna, over 49%, we have the data from Australia, of parents, they didn't know what is myopia. And at least 12% of kids, they've never been to optometrist or they had any vision checked. Apart from preschool checking and, at the other check at the age of 12, if they are at school on that day. As I said, myopia is multifactorial. There are different causes to cause myopia. One of them is genetics. If you have and one of the parents is short-sighted, the risk of myopia is 3 times. If you have 2 parents are short-sighted, the risk is 6 times. However, as I said, in the early 2000s, we noticed that it is not only the kids who their parents are short-sighted are becoming short-sighted. We're noticing kids who they do not have any family history of myopia. They are becoming short-sighted. And hence the studies noticed that, and we know very well, that children who spend a lot of time on close-up work, that include reading, whether books or screen, and it's the distance between the eye and the tasks. They are at higher piano. any close-up work, than or playing any type of music without taking breaks, they are at higher risk to become short-sighted compared to children who spend time outdoors. As well as we noticed, like the studies has been very well established, and there is like heaps of data to suggest children who spend more time outdoors, even if they are destined to be short-sighted, like their parents are short-sighted, they do not get myopia at early stage. And that's important because even if the person is, for different reasons, is meant to be short-sighted, if you get it at the age of 12 or 14, is much better than getting it at the age of 7, because myopia is a progressive disease. And in 77% of cases, it tends to slow down dramatically or almost to stop by the age of 17. But that doesn't mean for everybody, because our lifestyle has changed dramatically. But generally, the eye kind of stop growing by the age of around that age, and by the age of 21, 22, it will plateau, So if the person develop myopia, this is an important point, we need to make it clear. If the child develop myopia at the age of 12 or 13, that means they have 4 or 5 years for myopia to progress. But if the child develop myopia from the age of 6 or 7, that means they have another 10 years to progress. So hence the child who develop myopia at very early stage, there is very highly likely they will end up with a high myopia, which is the one I highlighted early, may cause irreversible visual loss. So what we are encouraging, kids who spend more outdoors, they delay the onset of myopia. Even if they meant to be short-sighted, they will delay the onset of myopia. So then, and kids who reduce their time on devices. Look, we are all parents. We know that it is hard to stop children from, because the homework is on devices, everything is on devices, and we are not swimming against the current. We can't do that. We want our kids to be educated. But all what we are asking is to get the balance right, to take a break. In summary, we thought, 0 to 6 years of age, no screen use under the age of 2. And what I mean by that, Anna, I see quite a lot of parents, they give their kids the mobile, or just to keep them busy, or that's screen time. You know what I mean? So we recommended no screen time for that age, and there is enough evidence in the literature and from a very prestigious universities that this really not good for the child development, for their motor skill, for their fine motor skills. So it doesn't teach them anything. Some parents, they think, oh, it's making my child smarter. To be honest, you need your hands, you need your vision, you need your hearing, all to work together to teach that toddler how to do things. There is a study published when they gave a toddler, it's almost like Lego or to work on the device. They did it perfectly for a toddler. And when they gave them a real one, they had no idea how to do it. So it doesn't mean, for the child is very smart to tick boxes because they lose their fine motor skills, and that's what they need, the course and the fine motor skills. From 6 to 12, we thought no smartphones or smartwatches access during a class. We mainly went for school recommendation because we cannot, that's what it is. We're not talking about family life. Parents are aware of their own kids, but for school, we restricted. Then we limited to 20-minute session and mainly to use it for educational purpose. Based on the age, for example, in toddlers and below the age of 6, why the screen? You know what I mean? They don't need screen time. They need a ball and a play outside. You know what I mean? They don't need screen time. So that's for them kids. And then when they become, yes, from the age of 11 and 12 and 18, yes, definitely they need it because this is their education. But all what we are asking, you limit the screen time for education purpose, and you teach the child to take a break. We say every 20 minutes or every half an hour, just to take 1 minute break. You know, like we used to say 20-20, every 20 minutes, take 20-second break. What I mean by break is to look at distance. You see, that's the problem, Anna, because in our generation, we read a lot, but with a book, you kind of get, you get after a while tired, you leave the book, you go and do something else. The problem with the screen, the kids, they get bored, but they surf to another thing, but they are still on the screen. So what happens, although I always tell the parents, although they are changing tasks, yes, they are doing math, probably they are playing music, but for the eyes, it's the same problem. You know, they are straining their eyes at the same distance. And that's what has been proven to push the eye to grow bigger and hence cause myopia. Luckily, the public awareness of myopia is getting more and more. I think because of the good efforts the optometrists are putting, the schools we're trying to approach schools now. With Julie's work, it's a great guidelines. We are trying to approach teachers and schools, to be honest, because I think, as you said, sometimes it is hard for parents, with your hard work group like you're approaching parents. We are working hard now to approach schools. Let the kids be kids. You know what I mean? Let them play outside, give them a ball and let them play outside. Encourage sports. Education is crucial, and I am full time on it, but it's a balance. It's a balance. It's good for their eyes, for their mental health, for their social skills. Just get the balance right. And just encourage, as a family, spend time together. Anna very well, time with our kids will never come back. They will, what I mean, just go, we try our best. I am a parent as well, and I know how hard it is. But just to try to think of this, it's as a priority. Once they become an adult, they are responsible for their own health. But as a children, it's sometimes it breaks my heart when you see the iPhone and the laptop is becoming the babysitter. Because quite a lot of parents are working from home. It is difficult for them. So they try to keep the child quiet. So they give the child the iPad, which will stay for hours. But that's not the way it should be. You know what I mean? Parenting is one of the hardest jobs you could ever do. And you just need to spend time with these kids. And also, please pass the message to the grandparents as well, because quite a lot of grandparents as well, when the kids, they stay with them, they, just give them the iPad and they do what they want. Let them do sports. Some sports, yes, I agree, it's expensive. But even I tell the kids, just juggle balls, just go outside and just buy yourself, play anything, rather than just spending time on devices. Yes, I am all the way through. You have to use it for education, but get it in balance. Take a break.